Welcome back. During the month of February, 13 WHAM is celebrating Black History Month by sharing each day contributions and advancements made in our community.
We certainly are. And this morning we're taking a look at a local group of Black women who are working to change maternal health and childbirth outcomes in Rochester, one doula at a time.
Our very own Stephanie Joseph has more.
As members of the Black Doula Collaborative,
a pledge to wellness in a room at the Strong-Todd House on East Avenue.
Educate and inform, foster communities,
where several doulas, part of the Black Doula Collaborative at Outreach Center Healthy Baby Network, meet for training over 12 weeks.
Well, a doula is basically a support person. They're there to support you during that laboring process, emotionally, physically.
The group started in 2019 with a mission after troubling data about pregnant Black women and deliveries.
Part of having a doula is making sure that we have better birth outcomes in our community.
According to the CDC, the maternal mortality rate was just above 50 deaths per 100,000 births for Black women in 2023, more than any other racial group.
Sometimes a lot of people come into the hospital with fear because they don't know, am I going to leave? Are we going to leave here safe? Are we going to leave here as a whole family unit the way we came in?
Pregnant Black women are also more likely to experience other outcomes like preterm births, something CEO Sharita Bullock experienced firsthand in 1994. Her daughter was born early and small, spending 5 days in the NICU.
I was heartbroken. I didn't understand what had happened. I didn't understand why my pregnancy was different.
Her goal is to help families get ahead of this.
We worked with a local foundation to train women from the community who were Black to become doulas and to work with other Black women and to provide services and care to them and to their families free of charge. And that work has grown from then until now.
For doulas, a part of the latest cohort, it's a responsibility they take pride in.
It feels like I'm a superhero a little bit, like I'm helping save people that look just like me, and someone was there to help me out, and I want to spread that.
And Stephanie Joseph, of course, is here in studio. And Stephanie, she said it very eloquently that, like superheroes.
Yeah.
Because they truly are. And, you know, she said she kind of feels like one, but you are.
Yeah, and it really does make a difference to have that extra advocate in the room. Doulas, they're not medical professionals. Obviously, they don't give medical advice like a doctor, don't take that role. But they are there for that emotional support, and they are birthing experts. So for new parents, especially if this seems daunting, they're there to give information and help out to make that process not seem as intimidating. But also we know that oftentimes in medical spaces, Black women, for example, aren't necessarily heard in the same way. So having somebody there to advocate and also make you aware of the plans you had in the first place in those stressful moments, it makes all the difference.
Steph, I'm wondering, right at the very start of the story, they were reciting almost an oath of sorts. What was that?
That was a pledge that they do, and that was before the start of the session. All of them, it's on a paper, they read it out loud. In this space, the collaborative sort of acts as a way for people to just talk about some of the things that they have experienced as doulas, and it's a place for them to, you know, bond and come together. They can relate to each other, share what they're experiencing, and offer advice.
How many are there within the organization? How many doulas?
So there's about 6 that are on staff, but then we also have the 35 in general from the Black Doula Collaborative, and they sort of act as the CEO was telling me, as backup doulas. So you have the 6 on staff, but if any more are needed, they're kind of that cohort there.
It is really so special. I've got to imagine that the mom that you spoke with felt so much love for her baby from, you know, complete strangers, essentially.
Yeah, that is for sure. And it's something that I've heard time and time again. This isn't the first doula group that I've spoken to. I've spoken to plenty others in the area, and they say that it really does make all the difference. And specifically for Sharita, she's been with this organization since its beginning, and this was actually her idea. So this is also like her baby. To see it grow like this is just immeasurable.
What has that been like for her?
It really was something. You know, when I was talking to her in the interview, she, you know, sat back with this and was like, this was actually my idea. And now to see it come to fruition like this and grow is amazing.
It really is. Steph, I've got to know, out of everything that you learned while working on this story, what was one piece of information that really made you stop and say, that is amazing. We're so fortunate to have that in our community?
That's a really great question. I think that there was so much that I learned and walked away with. I think, one, learning about this exact space and the fact that they meet over 12 weeks. So originally, one really interesting fact is that it would take around 2.5 days typically to train a doula, but they take those 12 weeks to really go over things like really get at the root of why someone wants to become a doula.
I think it's great that, one, that this organization exists, but two, that you did this story, this specific story, because I can only imagine how many expectant mothers there are out there, particularly Black ones, who don't know about doulas. Because, I mean, how many parents know what a doula is unless, you know, you ask?
Yeah, that's for sure. And I know that New York State, for example, has sort of been trying to lead the charge when it comes to this, raising awareness about this, but also for Medicaid enrollees, a part of the program, doulas would actually be covered now. So for a lot of people that may not be as fortunate to afford doula services, they now have access to this extra help.
It's fantastic. Steph, we appreciate you sticking around and telling us more about this story. We really, really enjoyed it. It's such a special group.
Yeah.
For somebody who wants to learn more, I imagine you've got the contact info and everything in the web story?
Yes. Yeah.
Terrific.
So check out 13wham.com. It'll be there later on today.
You heard her right there.
Wonderful. Thank you, Stephanie.